Good morning, Virginia. This is Virginia This Morning.
Removing hair from unwanted areas can be a constant nuisance for most women, but an alternative method could have you tossing the razors and tweezers for good and putting on these goggles.
That's right. These aren't just a fashion statement. Local specialty dermatologist Dr. Galen Fisher is going to demonstrate this morning the process of laser hair removal and how it can permanently remove hair from your body. Good morning, Dr. Fisher. Thanks for coming in.
Well, thank you for having me down. I appreciate the opportunity to come down and share with you some of the technology that we use in our office to permanently reduce hair in our patients that no longer want to shave their underarms or legs.
Okay, we're using glasses and goggles now. What's the importance of this?
The laser is able to interact with pigment-containing cells. So if you have cells that are dark, such as the ones on the back of the eye or around the base of a hair follicle, it heats them up. So to make sure that the eyes aren't in any way affected, we either shield them, which we'll do for our patient with metal shields, or for the treaters or the bystanders, we'll do it with just protective lenses that filter out the laser light.
Fantastic. Now, we're just, we can see fall on the horizon, summer's winding down, but this would mean for hair removal, it would be permanent all year long. You wouldn't have to fuss with it anymore.
It's a permanent reduction in hair, and fall and winter are great seasons because we really like to treat skin when it's not tan. You get your best treatment possible. It's laser hair removal we can safely do in all skin types. We just ask that the patients aren't tan before we treat them, and it is a permanent reduction. Everyone will see a different degree of reduction, but most cases, about 30% of the hairs that we treat will be permanently reduced.
Well, Dr. Fisher, what about for people of color? Because it's seeking out the dark pigmentation. Can we get this laser removal?
Yes, we use a different laser than the one we have parked here. We use a YAG laser, so it's a longer wavelength, and it bypasses the pigment that's up closer to the skin and targets only the pigment down deep. One of the key differences is in our patients with color, they might need 5 or 6 treatments, whereas most of our patients that are Caucasian will need around 4, sometimes 3, and sometimes 5. So just a few more treatments.
And again, because it's seeking color, what about people with blonde hair, gray hair, red hair?
Exactly. So if there's an absence of color, the laser will not work. In those patients, they would need to do electrolysis, waxing, or plucking.
Now, our brave model here, Amanda, has stepped into the limelight, and just a couple of days worth of growth, really.
Exactly. And what that'll allow us to do is to see the laser in action. So you'll see that the hair will become a little bit charred, in some cases may become vaporized and disappear. And it allows us as the laser operator to track where we have treated. So what we'll do now is go ahead and put some protective goggles if you're already.
Yeah. Goggles, safety first.
Just so we didn't forget, we figured we'd just wear them all together.
That's right.
They're a nice fashion statement.
I kind of
well.
like that it's a rosy glow.
That's right.
So what I'm going to do is remove the laser.
And what area are you going to do on her?
I'll step out and around.
We're going to go ahead and do the underarm.
Okay. And this is good for what parts of the body that you could utilize?
In women, we typically will treat bikinis, legs, underarms, occasionally chin and lip. In men, a lot of times they'll get the lower neck done, the back of the neck done, the ears, those sorts of areas. Sometimes men will want their chest or their back done. Those are our common areas.
Okay.
Okay, so I'm going to just do a test pulse off to the side.
Okay.
And now if you're ready, Amanda, I'll help you lift your arm up. In the office, we'll treat in the laying down position, but we didn't have a reclining table here. So here's your first zap.
So you can see a little bit of a light pulse there.
And we've actually exceeded the electrical capacity of the office. So in our office, we have it specially wired to support these lasers. In this office, in this room, I think we just caused an electrical fault. So we'll stop the treatment there and finish it at the office in a few minutes.
Okay, and Amanda, you're not Mike, but if you could just speak loudly, how did that feel?
Oh, it wasn't bad at all.
Wasn't bad at all. Okay, that's not I didn't feel a thing, but it wasn't bad at all.
I didn't flinch.
Yeah, no, you didn't flinch. That was good. That was good. And now, if she got the 4 or 5 treatments that she needed for this, would that become a permanent fix?
She would have maybe 1 or 2 hairs left. It's a statistical. So each time you treat, 30% of the hairs that you have when you start the treatment will essentially be gone. It won't prevent new growth. Suppose on men, your chest gets a little more hairy as you get older. So if you treat at age 35, you might have a few hairs come up at age 40 that weren't there at the time of the treatment.
And you have to return for a couple of treatments because not all are there at the time.
Right, so we space treatments out typically 8 weeks, and we'll do a series of usually 3 or 4, and then maybe have someone come back in a year for a touch-up to get the stragglers that are still present. But
And I'm asking this question to everybody. What's the cost? I'm money on my mind today.
Sure. It varies from a couple $100s per session to some people will want almost everything removed, and it can be $1,000 or more. So it depends on how long you're in the office.
But the time, money, and energy with shaving and waxing and plucking and all of those accoutrements that go along with it.
Yeah, there's not a nurse in my office who hasn't had this done. I think that speaks for itself.
That does. That's a good promotion for you right there. Well, thank you so much, Amanda. Thank you for
Thank
being
you.
and growing out your hair.
That's right.
for us today.
Thanks so
And
much.
finish it in the office. Dr. Fisher, thank you so much
Hey,
for coming in
thank
today.
you.
Thank you very much.
Appreciate it.